So, welcome and thank you for joining. This presentation focuses on the journey from competence to credential in addiction nursing and introduces the new ICAP RN, or the International Credential for Addiction Professionals for Registered Nurses. This is an important global development in strengthening nursing practice in substance use care. So the ICAP-RN represents a global badge of credibility for nurses working across all settings where substance use impacts care. Credentialed nurses are essential to advancing compassionate, competent, and evidence-based addiction care worldwide. Substance use disorders, I hope you now all appreciate having undertaken the UNAC, affect patients in all healthcare environments. They are seen in emergency departments, medical surgical units, primary care settings, mental health, pediatrics, older persons nursing, and community care. We also see addiction presenting in what we might consider beyond traditional healthcare settings, including workplaces, schools, and the criminal justice systems. Nurses encounter addiction whether it is disclosed or not, making addiction-informed care a universal nursing responsibility. You will have heard, certainly myself and Dr. Berda, say from the beginning of the UNAC course that we've been introducing these concepts to you, but that every nurse is an addictions nurse. And really, with over 30 million nurses worldwide, we hope that you appreciate why we are saying this, primarily because we know that nursing is in every part of everybody's lives, whether it's from the point of birth through to the point of death. And nurses assess pain, they administer medications, they monitor withdrawal, they're able to engage in early recognition, such as prevention complications, reduce overdose risk, and support timely referral to treatment. They can also, we now know, through ESPERT, have brief interventions which can save lives. So you don't need to be working directly in an addiction unit to encounter addiction or influence outcomes, or indeed, more importantly, make care safer and more compassionate. So we say every nurse, as you know, is an addictions nurse. So why addiction care requires what we would say specialized skills? And hopefully by now, having undertaken this course, you will recognize that substance use disorders are complex. They're also chronic, and more importantly, they're relapsing conditions. Patients often present with co-occurring mental and physical health issues, and there is a high risk of stigma, safety concerns, and ethical challenges. So specialized education and training, which is often not addressed at undergraduate or pre-service nurse training, really does need to be provided. Ideally, we would like to see that embedded into nursing curriculum. But as we are evolving and learning, we just don't have perhaps the resources, or we don't have faculty with the specialist knowledge and skills. So invariably, this sort of training happens after somebody is a qualified nurse. But we do know that it's required, and we do know it's essential, given the nature of nursing, and given, as we've said, the prevalence of substance use within our communities. And so therefore, we really strongly believe that training improves clinical judgment and ultimately patient trust. So what's the role of credentialing? You're all credentialed at this point. You're all nurses. You're all qualified and licensed in your respective jurisdictions in your countries. So when we're talking about credentialing, what are we talking about now? Well, what we're suggesting is that in addition to your nursing credential, which you have achieved, or indeed any other academic credentials you may have achieved on top of your nursing, and that could be at the level of master's or doctorate, that we really believe that there is a need to credential substance use education, and specifically substance use education for nurses. And we believe that credentialing will ensure nurses are prepared, trusted, and equipped to deliver safe, compassionate addiction care, again, because every nurse is an addictions nurse. But in addition to that, we actually believe it protects patient safety by verifying evidence-based competence in SUD, in substance use disorders. You may be very, very competent as a trained nurse, and quite rightly, you've achieved your license, but how can you verify and evidence to patients or indeed your employer or to your community that you have, in addition, additional skills and knowledge, having undertaken some additional training, such as UNAC? So that's really what we're about. We're about that the credentialing will also be a marker or an indicator of quality of care for complex conditions like substance use disorders. It establishes professional credibility and accountability. It reduces stigma by reinforcing ethical, trauma-informed, person-centered care. And by that, I mean evidence-based. If you are credentialed and you've been through a training such as UNAC, we hope now at this stage you will be evidence-based in your approaches, and therefore that will all seek to continue to challenge and reduce stigma, and supports lifelong learning and leadership guided by the professional standards that we've been addressing and covering within the UNAC course. So credentialing, we believe, ensures nurses are prepared, trusted, and equipped to deliver safe and compassionate addiction care, because every nurse is the addictions nurse. And it's important to note at this point, while I'm talking about credentialing, that the ICAP credentialing services, which were originally established by the Columba Plan, were formally transferred in early 2024 to the International Consortium of Universities in Drug Demand Reduction, or also known as ICU-DDR. This transition ensures the continued growth, governance, and global reach of ICAP credentialing within an academic and evidence-informed framework. So to assist your understanding, we thought it might be helpful at this point, as we're wrapping up the UNAC course, and for you to understand where the ICAP credential sits within all of this, is to just cover a little bit about who and what ICU-DDR is, and also explain the purpose and goals of the Credentialing Centre, which operates as part and under the umbrella of ICU-DDR. So we've got here the vision, which you can see, and the mission. So here, the vision here you can see in front of you is that ICU-DDR envisions a world where people with substance use disorders and related conditions have access to science-informed prevention, treatment, and recovery support services. The mission is to build and support a worldwide network of colleges and universities to improve professional competencies in preventing and treating SUDs and related conditions, and increase access to quality services and reduce global disparities. And to accomplish this, we provide the following. So ICU-DDR provides support to expand and improve college and university-based education. It supports to expand research, networking, and collaborative opportunities, advocacy for improved quality and access to services, and up-to-date science from the field. And the value proposition of ICU-DDR is set out as: we are a global consortium of institutes of higher education linking science, policy, education, and service to address substance use challenges and strengthen communities. So how does that work? So we have regional coordination and digital engagement. So through regional coordination and digital engagement, ICU-DDR continues to raise awareness and build capacity globally, a little bit like ISSUP or ISUP, which will be another organization you will be familiar with. And ICU-DDR includes and offers webinars, online resources, social media engagement, and a growing digital repository of research and training tools that support addiction education and workforce development. So here you can see we're in Europe, United States and Canada, Africa, Asia, Middle East, and the Latin American and the Caribbean. And you can join as an individual, or you can join as a university or as a faculty member. So particularly if you are a nurse who is working or associated or linked in with the university or a higher institute of training, you may be very interested in joining this particular network. And here's just a little, some really just stats, which I'll let you read on your own, but you can see the sort of activities and the sort of volume of material that is being supported and shared, either through social media or the newsletters, or as you can see, webinars. And the webinars are free. So again, look out for that. And if you're not registered for our newsletter, we certainly invite you to join up, and there is a QR code at the end of this presentation. So that kind of gives you a little idea of the overarching proposition of what ICU-DDR is about. Now I will explain that there are four sort of centres that operationalise the work of the ICU-DDR group. And here you will see on the right-hand lower corner, Centre for Credentialing and Accreditation, which is really where the credentialing and the ICAP sits and is overseen and managed. And that's what I'm going to tell you a little bit about now, because that's the group that is responsible for the ICAP RN. So just on this particular slide, you can see, in effect, CCA, or Centre for Credentialing and Accreditation's purpose, and a little bit about the staff. So you've got me as the director, and then you have Mr. Sunju Park, who's one of the senior program officers, and Ms. Samita, who is actually out of Sri Lanka, also senior program officer. So if you contact us, that's who you're going to hopefully meet or communicate with, either online or via your application and so forth. So the centre here, as you can see, and its purpose is committed to elevating the quality of care in substance use services by ensuring a well-trained credential workforce. It professionalises the workforce through credentialing and accreditation, fostering high standards of care worldwide, and also supports the higher educational institutions such as universities in influencing workforce development policies and practices. There are four goals. So here, develop global standards for workforce credentialing and organizational accreditation, expand access to credentialing programs, especially in underserved regions, increase the number of certified professionals. So even though we're going to be talking here specifically about the ICAP RN, the centre also offers ICAPs in treatment, in recovery, and in prevention, called the ICAP treatment 1, 2, and 3, and 4. So there are 4 levels, and the higher the level, the more advanced the practice, etc. And then we also are now just introducing the new ICAP RN for nurses. We establish accreditation systems for organizations to ensure adherence to evidence-based practices, and we partner with governments and international bodies to make credentialing a policy priority. So very much trying to influence from both sides, as they say. Just a little bit about how the governance is set up. So you can see that the centre is here on the bottom right-hand corner, and we have a commission which is representative of the regions and key people within those regions who are working on credentialing or working in training, or indeed working in the level of government, trying to progress and promote workforce engagement and upskilling of staff within the country, particularly on SUD matters. And then that centre reports through to the ICU-DDR and to the ICU-DDR board, alongside the other centres within the ICU-DDR family. These are some of our activities, and on the left you can see these are the credentials that I just mentioned. So you can get a credential in prevention or in treatment 1 through 4, or recovery support, or, as I say, this new one, which is the ICAP RN. And this is the first one which is specifically for a discipline in nursing. And we've already had a lot of people very keen for us to consider doing ICAPs for psychologists, for pharmacists, for doctors. So watch this space. But it's quite exciting that the first one, which is discipline specific, is in nursing. So these are the activities: professionally accrediting of credentialing service substance use specialists. We're providing global standards for substance use professional certification. We are developing endorsements for specific populations, and micro-credentialing for short-term training, offering stackable credentials. So those are sort of broadly the activities we're involved in. So what does it mean if you want to move forward to get a credential, the ICAP RN? Well, here are the steps, and this is what you will be required to do. So you will join ISAP Global Network. I think many of you have already done that anyway. You'll take courses, and the UNAC course, although you don't have to specifically take the UNAC course, but the UNAC course has been aligned with the expectations and standards of the exam. So it's the best, or we would certainly recommend this course for you to take if you're interested in moving forward to take an ICAP credential. However, there are many, many places where people can undertake studies which could equally prepare them for the ICAP RN exam. So it's not precluded, but we're very happy to talk that through if you have colleagues who have already undertaken courses and would like to consider to move forward and take an ICAP RN credential. So we then look at your eligibility. So it's both based on your educational achievements and that you are working as a nurse, working as a registered licensed nurse within your own jurisdiction. And there are a variety of other criteria which we can share with you should you move forward and are interested. We then get you to document your experience and you fill in a full application form so we can review that. You submit that application, and should that application be approved, you would then move forward to take the exam. And then once you've got the exam, you would actually be placed onto the live register. So again, if you go to our website, you'll note that we have a live register. So you have to review your credential every 3 years and come back every 3 years and show us that you're continuing to practice and you're continuing to learn and do lifelong learning. You need to do so many hours CPD, etc., during that 3 year period. But you don't take the exam again. You just demonstrate to us that you've kept yourself up to date and in tune and in touch with evidence-based practice. And we then keep you on the register really for as long as you're continuing to practice and meeting that criteria. So it's not too arduous a process, but it does take a little bit of thinking and a little application, but we're very happy to talk that through and very happy to do specific webinars with you post the UNAC training if that's something that you're interested in pursuing. The elements of satisfactory ICAP application are shown now on the screen. So you sign a code of ethics, even though you will have signed up to your nursing ethics within your respective jurisdiction. We do ask you to sign the ICN Code of Ethics, which is really the International Council of Nurses Code of Ethics, and nothing that you won't be familiar with, and probably represents the codes of ethics that you've already signed in your respective countries. We will be looking to make sure that you've done certified calculation of contact hours in terms of training. So the UNAC will certainly be an aspect of that. So if you've already achieved your certificate of attendance for the UNAC course, that certainly goes a long way to meeting that criteria. We will want a detailed CV highlighting your highest education level and dates. There will be a need for a recommendation from a clinical supervisor verifying your years of experience. We ask you to describe the sort of work that you're doing. And then we also ask for copies of your university certificates, government issued photo, and that you are a licensed nurse practitioner in your jurisdiction. So all of those will be documents that you'll upload and that we will review and make sure that you fit the criteria. You can take an ICAP if you're not a nurse. So, but this is specifically the ICAP RN. So the minimum criteria must be that you are registered and licensed within your own country. So just to explain, this is a brand new credential. Nobody actually has the ICAP RN yet. So if you are moving forward and want to take this, you will be one of the newest people to take this particular credential. It's currently being implemented, and we're in the process of establishing the online application portal and setting up the approved exam centres where you can take the ICAP RN exam. The first available exam that we are trying to set up at this point is in Uganda, to coincide with a conference that's taking place in April. So if that is of interest, do let us know and speak with us, because if you're living in Uganda or close to Uganda, can get to that venue, then we'd be very happy to facilitate you taking the ICAP RN exam in April. To receive updates and be placed on the ICAP RN examination mailing list, then we ask you to complete an expression of interest form, which is actually embedded into the platform for you in the mission, on this mission. So please download that form and submit it, and we will certainly get back in touch with you and follow up with you as the process continues and we start to establish where these exams can take place. You won't be able to take it online, you'll have to take it in person. So it's all a matter of us making sure that we can find the appropriate venues for where you can take that so that both the exam is secure and you have the right setup in order to be able to undertake the exam. So just noting, completing the form does not constitute the application itself, but ensures you'll be notified when applications and exam dates become available. So keep a watchful eye out. These are the QR codes. The first one on the left will take you to the ICU DDR website, and the one on the right takes you specifically to the centre so that you can read more about this. And certainly you know how to contact both myself and Dr. Berda. So we will continue to work with you as we move forward in getting you registered if that's what you wish to do in order to take the ICAP. So thank you for your attention on this, and we look forward to receiving any further applications and for you to become the first cohort of ICAP RN nurses, which would be super exciting. So thank you guys. Thank you very much.